All right, let's get started. Hi, everyone, and thanks for being here for CAHA's third Healthy Conversation, Becoming a Sustainable Healthcare Champion. My name is Stephanie Carino, and I'm CAHA's Sustainable Healthcare Program Manager. Today, I have the pleasure of welcoming you all and then passing over to the very capable hands of Catherine O'Shea to lead this exciting panel discussion. Before we go any further, I'd like to acknowledge the lands that we are all meeting on today. Here in Naarm, Melbourne, I'm on the unceded lands of the Wurundjeri people of the Kulin Nation, and I pay my respects to elders past, present and emerging. At CAHA, we recognise Aboriginal and Torres Strait Islander people as the traditional custodians of the lands on which we live and work, and acknowledge that sovereignty of the land we call Australia has never been ceded. We commit to listening to and learning from Aboriginal and Torres Strait Islander people and organisations about how we can better reflect Indigenous ways of being and knowing in our work. So I'd like to take the opportunity to go over some housekeeping before we begin. I would encourage you all to update your Zoom name if you haven't already to include your name, preferred pronouns and the country that you're on. Please also feel free to introduce yourself in the chat box with a bit more about yourself and why you're interested in sustainable healthcare. You can use the chat box throughout the event to ask questions and engage with each other and the speakers. Please keep your microphones muted during the session, and where possible, please keep your cameras on. Please note that this session is being recorded and will be made available after the event. This event is also being live tweeted from the Healthy Climate account. If you'd like to join the conversation online, don't forget to use the hashtag #ClimateHealth. So now I'd like to hand over to our wonderful facilitator for today's event, Catherine O'Shea. Kath is no stranger to sustainable healthcare and currently works as the Sustainability Analyst at Ambulance Victoria. Kath has been in health-related roles for 35 years, having started as a registered nurse. She also completed a Master of Environment at Monash University and has transitioned through various roles under the banner of sustainability in healthcare since then. She is passionate about this field and the importance of climate change as a health issue. I'll pass it over to you, Kath.
You're on mute, Kath.
Thank you, Steph. Sorry, it's great to be here today, and it's my pleasure to introduce our wonderful panellists to this discussion. So I'd like to start by first introducing Sue Crosbie. Sue has been working at Nepean Blue Mountains Local District Health for 20 years and has worked across the corporate sphere of health. Sue is currently working with her director to create a climate risk and net zero office for the district, and is also the chair of the Climate Resilient Healthcare Working Group, which is rolling out the Climate Change Risk Assessment Program. Sue's passion for sustainability is driven by wanting a safe future for her 2 grandkids. She loves to travel and see the sights of this amazing planet and wants them to be there for future generations. Thanks for being here, Sue.
Thanks for having me.
Lovely. I'd like to now introduce Bridget Egan. Bridget is the Sustainability Officer for South Metropolitan Health Service in Western Australia. In this role, Bridget leads and manages the implementation of the sustainability program and associated initiatives across SMHS and seeks opportunities to improve the organisation's environmental performance. Bridget works closely with the newly established Sustainable Development Unit at the WA Department of Health and alongside medical and nursing leads for climate health and environmental sustainability. Prior to taking up the sustainability portfolio, Bridget was a communication specialist at SMHS, and she brings those skills to enhance stakeholder and staff engagement in environmental sustainability. It's great to have you here, Bridget.
Thanks, Catherine.
And last but not least, I'd like to welcome Dr. Emma-Leigh Synnott to the panel. Emma-Leigh is a consultant physician in rehabilitation medicine, working in spinal rehabilitation medicine. Until recently, she was the medical lead for climate health and environmental sustainability in the Fiona Stanley Fremantle Hospital Group. Emma-Leigh has just this week moved to the Department of Health, WA, where she is the medical advisor to the Sustainable Development Unit. Emma-Leigh is the current chair for the WA Committee of Doctors for the Environment Australia and is a founding member of the WA Climate and Health Community of Practice. She is interested in transformative system-wide reform to centre the concepts and values of planetary health, climate justice, and sustainable development, with an aim to create holistic, thriving, regenerative, integrative, and just futures for our world. Thanks for joining us, Emma-Leigh.
Thanks for having me here. It's great to be here.
Lovely. Okay, without further ado, let's get started. Our first kind of topic is about getting involved, and in reflecting on that topic, I think I've spent probably about the same time in as a clinician as a sustainability professional now. So I was kind of thinking about which one was maybe easier or harder of those. And I think they're both incredibly satisfying and rewarding and fulfilling. But I think that sustainability has the edge on challenge. That was my reflection anyway. So I'm interested to hear how each of our panelists became involved in sustainable healthcare, and what advice they have for us here today. You might want to be a sustainable healthcare champion in the workplace, but don't know how to get involved initially, or also for anyone in the audience who wants to put their own story or share anything in the chat about their sustainability journey, please feel free to do that too. So Sue, let's start with you. How did you first become involved in this space, and what advice have you got for others who want to get involved?
So I attended a presentation given by David Pynchon, who I'm sure some people know. He's from the UK, and that was back in 2018. And at the time I needed a project to complete my MBA. So I discussed doing something around sustainability with Scott Hansen, who I met at that presentation. He was new to our organisation as our energy and sustainability business partner. So we started with a project to develop a tool to prioritise sustainability projects. And then after that was completed, we realised that our district actually needed a sustainability plan. So we developed one and presented that to the executive team, who then approved it, which was really good. And the plan set the foundational work for our district in sustainability, and was based on having a sustainability committee, working groups, and living focal point documents that could be changed or updated as we progressed. So we didn't want that plan just to be written and then sit and get dusty on the shelf, as they say. So everything we're doing in the sustainability space at our organisation actually started from that chance meeting at a presentation.
Wow, that's amazing.
Yeah, so lots happened since then. So Scott and I both have a passion in this space. For me, as I said in my bio, it's my grandchildren. And most of the work that we've actually done to date is outside of our position descriptions. And actually, I have to say, for me, all of it has been outside of my PD. So my advice, if you want to become a champion in this space, is to find something that needs to be done within your workspace or your sphere of influence, and find some like-minded people to support you and just get started. It doesn't need to be big, and it doesn't need to change the world. Just look at a small project and something you can actually do, because everybody doing something will change, what happens in the long run.
Fabulous. Great advice, Sue. Thank you so much. Yes, David Pynchon is a very inspiring character, and I can see why you hit the ground running after that, because he makes it quite clear that there's a lot to do. Thank you. What about you, Bridget? How did you first come into sustainability, and what advice might you have for the people here today?
I'm probably a little bit unique in that I don't have a clinical background, and I think most people that end up in this in environmental sustainability perhaps come from the clinical side. I was on the South Metropolitan Health Services Environmental Sustainability Steering Group in my role as a comms manager, and so that was started really some agitation by some clinicians who wanted to see action on sustainability in our organisation. Emma-Leigh's smiling because she's one of the agitators, and we got this. The chief executive was brought on board, extremely supportive, formed the steering committee. And so I was there in my comms role. And out of that steering committee, there actually became the first position for sustainability in our organisation, the sustainability officer. And that role, the person that was in that role was in it for about 6 months, and then the opportunity came up for me to step into that role. So I jumped at it. It was a challenge that I could see enormous amount of work to do, but really exciting as well, and something that I find that the majority of people in our organisation are engaged with and want to be involved in. So it's really energising in that respect. My advice would be to anyone out there wondering how they get started is Sue said, just get started, pick something, pick a project, get started, but also find out what already exists in your organisation and tap into what might already be happening. Quite often I find people are out there beavering away thinking no one else is doing anything. It's about putting your head up, talking to your executive, talking to your managers, or if you are in that level, to actually start driving some initiatives. It's really find like-minded people, form a committee, form a group, start talking, and there's no risk in putting your hand up to take action and to do something, because there is a lot of energy in this space, and a lot of like-minded people will get in behind you, and before you know it, you'll have a little revolution on your hands.
Absolutely. Thank you so much, Bridget. Beautiful. And Emma-Leigh, can you tell us a little bit about how you entered sustainability and maybe some advice?
Yeah, so I guess I have always been interested in the environment and sustainability. I had the privilege of growing up in beautiful tableland country up in northern New South Wales, and I lived in the bush, and I lived in those wild places, and I was surrounded by wildlife. And I guess my parents instilled in me this strong moral standard, a need of service and a mission, I guess, to work to look after the world around us and look after the living things that we shared our world with. Through that, I actually did veterinary medicine initially, and then went on to study human medicine. And it was only after I studied those things that I started to recognise that interconnectedness. So the health of humans, the health of all living things, and the health of our world. And so when I started reading and looking into this even further, I stumbled on Doctors for the Environment. So Doctors for the Environment Australia, for those who aren't familiar, but I'm sure most of you are, it's an organisation of medical doctors who understand that human health and the well-being of our planet are intimately connected. So to protect the health of humans, we need to protect the health of the world around us. And so DEA kind of opened up a world of information and opportunity. And through that, I actually started looking at the harm that we were doing in health. And I guess it went against those basic fundamentals of provision of healthcare. So at first, do no harm. So when I found DEA, I found a network of passionate, informed, like-minded individuals. So that's where it all began. And I guess that would be my advice to anyone who wanted to start on this journey. It's look for your people. Find those people who are there with you, who are engaged, who are activated, who are motivated, and who you can, I guess, network with, build thought leadership, and go out there and, I guess, change the world. So yeah, find your people, start a network, and never lose your passion. Find your true north and follow that and work with that.
Oh, I love it. I love the passion. Thank you, Emma-Leigh. Fabulous. Now, your bios are all very impressive, and I'm excited to hear more about the work that you're all doing to create change in your workplaces, to make sure that they're low carbon, sustainable and resilient. So we might come back to you, Emma-Leigh. You talked about Doctors for Environment. If someone can't jump into Doctors for the Environment immediately, that's a fantastic organisation. What are some of the easiest ways to create change and promote sustainability in the workplace, would you suggest?
Yeah, so a few things. Again, learn your why. So I think when anyone in a workplace can be a leader, you are a leader in the way that you present yourself, in the way that you interact, in the way that you can follow and define a vision for a better future. And that's what we're all doing in health. So make sure you stand by that and speak up. Just start to live that and start on something small that you maybe have some direct impact on. Start by changing your own practice, but then reach out and find people who will stand there with you, build a network. So they would be the three things. Learn your why, speak up, start small, find something you can influence and change that. But through those things, you will find your people and you can build voice and build a community of like-minded individuals around you who can then go on to help, I guess, as in the words of Bridget, agitate for change in your organisation.
Yeah, great. Well, Sue, what are some of the things that the Climate Resilient Healthcare Working Group have been doing at Nepean Blue Mountains Local District Health?
So this working group manages the Climate Resilient Healthcare Focal Point and the Foster Partnerships and Staff Participation Focal Point. And we're now also developing a new one for net zero planning. It's also the working group with our external membership. So we've got council reps, universities, PHN and other partners, external partners. And our internal members include media and comms, research staff, public, population and community health, and also our disaster manager. So we currently have a couple of key projects that we're working on. Firstly, we're leading the climate change risk assessment process across the district, and we're working in partnership with health infrastructure on that one. So the aim is to develop a health-specific toolkit based on the New South Wales Treasury Climate Risk Ready Guide and resources. So Ingrid from Health Infrastructure and I are working on that. We actually met doing the training course. So they recommend you look that up and consider the training course if you're interested in this space. We're also working with the Ministry of Health and consultants on a carbon footprinting project for our Nepean campus. And the ministry are leading that project, and the aim will be that they have a statewide carbon footprinting data processes and tools. So that's huge, and we're really, really excited to be working on that one with them. And while we've been hit by COVID, you know, we've had a few delays in getting this off the ground, but we're now actually also making progress towards our research and community partnerships. So we're really working with our partners, our external partners more closely, and we're developing program logic tools to develop and identify outcomes and planning roundtable discussions with the unis to identify research opportunities. So actually there's so much happening now, it's almost getting hard to keep the balls up in the air, but it's great, it's really exciting.
Absolutely, that's a lot. Fabulous. Bridget, what are some of the ways that you have found to make your organisation more sustainable in its performance?
What I've found is that there are so many people out there doing sustainable things. So it's really pulling all those things together and understanding what's being done across our organisation, and then also seeding those ideas in other areas. So we've had, and thanks to the work of Emma-Leigh and her colleague Jen, who's our nursing lead, we've had the departments, various departments take up the responsibility for looking at their own local areas and the types of things that they can do locally. No one knows their business better than the people actually on the ground doing the work. They know what waste they're generating. They know what wastage there is, and they all see opportunities for sustainability. So very much encouraging those local green groups to get up and running and supporting them as much as I can to make sure that they can make a real impact. I've worked with the catering teams to roll out food organics, recycling, so or to go to compost. So that's been huge. They work really hard to reduce the amount of food waste in the first place, but there's always unavoidable food waste, and redirecting that from landfill has been really important and a big breakthrough for us. And this year, on Plastic Free July, we launched a Bluey campaign to reduce the number of Blueys used across our organisation. We are always looking for more sustainable items to use in replace of those that are in high use in our organisation. But in the meantime, we really wanted to run a campaign to raise people's awareness about this very handy, always there product that they just reach out for. They don't think about it's cheap, cheerful, does the job. But just to highlight to people how many we use in our organisation every year. So it's about 440,000 are used across just our health service, which is massive. All of them go to landfill because they can't be recycled. So in running that as an awareness campaign and asking people to reduce their bluey use, hopefully we're also getting people to think about other things that they use on a daily basis that are overused, not used appropriately, and perhaps they could be using other things instead that are more sustainable. So there's so many opportunities out there in energy. I've just been down to one of our hospitals that's been refurbishing some wards, and they've made a huge effort to make sure that everything is sustainable in terms of energy. They've installed all LED lighting that dims and switches off after period. So using technology to help in that energy reduction. So they're going to reduce their power, their energy usage by about 30% this year as a result of those changes. So there's so much opportunity within our organisation, everybody's organisation. It's really, I could take up the rest of the session really talking about the kinds of things that we've been doing, but there's opportunity everywhere you look, essentially. And I work very closely with the product liaison teams that are always out there looking for alternatives to and more environmentally sustainable alternative products as well. So yeah, there's plenty of opportunity wherever you look.
Perfect. And following on from that, Bridget, you seem to have the knack of involving staff. So can you talk about how important it is to get these colleagues on board and how you've motivated them to get involved, perhaps?
Yeah, one of the first things that we did when I came into the role was establish our Green Ambassadors Network. So that is inviting staff, no matter where they are in our organisation, to sign on to be a Green Ambassador. And it was all about really empowering people to take action, so they felt they were part of something bigger than just themselves. And it's also a support network for people to share ideas, to come together and to talk about what they're actually doing in their own areas, inspiring others to do the same, and also helping them overcome any barriers they might be coming across in putting a sustainability initiative into place. But that sense of belonging, as Emma said, find your people, and it's about creating that community across our entire organisation. We've got 5 hospital sites where we cover a huge area, and enormous. We have nearly 11,000 staff, so we're a big organisation. So finding your people in our organisation, you know, is not always easy. And so through the Green Ambassadors Network, we've done that, and we've got 170 plus Green Ambassadors across the organisation. Everyone gets a nice little badge to wear, but also what that does in the reverse is helps me tap into the kinds of things that people are doing at a grassroots level, and communicating that out to the group. So there's to the whole organisation. So the rest of the organisation can see the types of things that are being done, and then hopefully getting people engaged in that. Things like this conversation today, publicising that, making sure people have the opportunity to educate themselves, find out more information. The more educated we are, the more information we have, the more likely we are to take action and make those changes. And our Green Ambassadors Network, the tagline for that is Think, Act, Change. We wanted a call to action, so it asked people to think about where they can make a difference, see what action is needed to make that change, and then obviously to carry out the change, the behaviour change, or the process change, or the workflow change, whatever it might be. So Think, Act, Change is sort of the umbrella tagline that we use for Green Ambassadors, hopefully to empower people to do just that.
Very effective. Sue, you've also been involved in the creation of the new Climate Risk and Net Zero Office for the district. Can you tell us a little bit more about that work?
Yes, I should actually clarify, we're in the process of setting that up at the moment. Okay. It's not officially there yet.
That's okay.
Hopefully by the end of September, we'll be up and running. We also haven't quite decided on a name yet, but it'll be something along those lines. Sure. So when we set up our sustainability plan and our sustainability committee, we made the director of finance the chair, because we figured that nothing actually happens without financial backing, right? So then my role actually got moved into the finance department, so that helped me have greater influence with the director. And then recently our acting director was doing some training at a very high level, and he had to do a sustainability project himself, or a group project. So he was actually starting to see what the issues were that we're facing from a state level perspective, and getting a grasp of just what's coming in this space and how big the impacts are going to be. So that was really an eye-opener for him and really valuable for us. And then as chair of our sustainability committee, he was also starting to see the work that we've been doing in this space already. So he was quite impressed. So, you know, he's actually really on board, which is great. So we pitched the idea that we needed to have an office, and that Scott and I needed to have position descriptions that actually match the work that we're actually doing. So we really wanted that to give sustainability a really legitimate focus in the district. And, you know, so thankfully he and the CEO both agreed that that was required. And so we're working towards that now. And it will just be the two of us to start with. And we'll be sitting within our total asset management team, but I'm hoping we can rename that to the sustainability and asset management team. So I think we're getting some traction there. We've got a really engaged manager. She's calling us the Sustainability Cool Kids Club. So that's great. And we've got some grand plans for what we want to achieve. So we're really looking at that. What are the outcomes and the focus of where we want to go with this? And we're hoping that down the track that we'll be able to get a green travel plan coordinator and a waste project manager officer as well, so that the team can sort of grow. But we'll have to obviously show the business case for the financial and environmental savings that we can make from that. So we're really excited. It's a great space, and we really feel like, you know, the organisation is really taking this seriously. So it's very exciting.
It is. Wow, fantastic. Emma-Leigh, you were also able to create your own change in the workplace by advocating for the creation of your own role when you moved on from the medical lead for climate health and environmental sustainability. Can you tell us about how you're able to achieve that?
Yeah, thank you. So I guess it was probably likely the case of right place, right time, really, and that accumulative result of constant discussion and pressure and conversations. So as I mentioned, I used to live in New South Wales, but I moved to Perth in 2017, new hospital, new city, and I had been involved with Doctors for the Environment in New South Wales, so reached out to the local group in Perth when I moved over. And it was through Doctors for the Environment that I found a group of clinicians at Fiona Stanley Hospital, where I just moved to, who were interested in this space. So again, I found my people, started talking, and I started talking to everyone I possibly could. So I actually reached out to our chief executive, who Bridget mentioned earlier, is incredibly supportive and responsive. And from there, with this group of clinicians, because it is about people power, we started to work on building momentum for what I describe, and what is probably best described as that transformative change across Fiona Stanley Fremantle Hospital Group and the wider SMARS. So through that, we created a sustainability framework. We advocated for, and successfully advocated for, I might say, Bridget's role. That was great. And then we also, I guess, helped from that build governance and mechanisms for action throughout the organisation, such as the steering committee. I had also started to be involved in some of the statewide processes going on, and just happened to drop in during a lot of work more broadly that was looking at sustainability of the Western Australia Health Service. So the Sustainable Health Review, and out of that, the Climate and Health WA inquiry, which many of you may be familiar with. So all of these things that had kind of been happening just came to fruition at that moment. And it became something that everyone was talking about. In 2019, I found myself on the executive committee. I was the medical director for my service at the time, and it was there that I had conversations with other executives, and also the executive director, Neil Doherty, who, again, very supportive, saw my passion, talk underwater about this issue. And he also knew how organisations worked. So it was the people who had that organisational knowledge, that knew that for any transformative change within a health organisation or a health service, you actually you require engaged clinicians and clinical leadership. So with that knowledge and with my commitment to the area, we kind of sat down and we co-developed this role, which I've been in, or I had been in, since late 2020. So going on 2 years now. I guess understanding that really where most people focus on facilities management in an organisation, the real brunt of work and the real value and valuable work that needs to be done in creating more sustainable health services is that clinical work. So how do we actually create really healthy, thriving people that require less health services? And when they do require health services, what are we doing to make sure that we're not creating harm in that provision of care? So that was where it all started from. It was just that conversation, that constant conversation, and then also being able to articulate the why of it. Why is it important? So from an organisational perspective, we'd signed up, we had committed. It was now a strategic priority for the organisation, and for the organisation to shift, we needed clinicians on board. Clinicians, speak to clinicians. It's that ability to translate and ability to inform. So having that clinical leadership to help the organisation on its pathway, and then also having that knowledge of what needs to be done to help clinicians do this work better. So, can we prevent, looking at more preventative health strategies, empowering our patients, also reducing the harm of the care we delivered. What can we do to help to build capacity within our workforce so they can start to do those things, and build that momentum and that movement. Yeah.
Fabulous. Yeah, some great perspectives there. I'm hearing that, there's the corporate side, and then there's the tools and the resources, and the clinical side. There's really so much to it. And I guess achieving all those amazing things can't have been easy. And I can imagine that you've all faced different challenges along the way. Bridget, can you tell us about the challenges you might have faced as a sustainable healthcare champion in your workplace and how you overcame them?
Still overcoming them. I think one of our biggest issues we've faced, and everyone has been the same, is how sidetracked we've all been by COVID. Rightly so. There's no question that it obviously consumed everyone's attention. But with COVID has come that fatigue and workforce shortages. We've got all sorts of issues just in keeping our hospitals running and running efficiently and safely. So getting then oxygen and getting people to focus on things other than just the care they need to deliver today has been really challenging. There's still the will out there, but I've just noticed a bit of a drop off in the kind of traction that we've been able to get. I feel like we've come out the other side of that, and people are now looking for things other than the day-to-day, and they're also seeing that people are not happy about the amount of waste with PPE and all of that, and wanting to be a bit more motivated in that space. So I think that's been a really enormous challenge, just people's headspace for doing that little bit extra, or thinking outside the square, or making change. Change fatigue. Throughout COVID, every week there were new directives, there were new things to take on board, new ways of approaching things, and they're still changing. In WA, we're on code blue at the moment, so that brought with it a whole lot of changes. So it was really, it really is about trying to keep people engaged, but finding that balance between feeling like you're berating people, harassing people, and encouraging. Because at the moment, everyone just seems a little, I suppose, at their limits, and we've got to be really mindful about that. But that said, I'm encouraged every single day in my engagement with staff members around how much enthusiasm and energy there is to do things differently, and to make change. And they're always seeing opportunities where they can make change and do things differently. So I'm and make sure I get in and support them and point them in the right direction so they can get the support they need to undertake whatever project it is that they want to do. So I think that's, like I said, I think we're coming out of the worst of it, and now I think we'll see another phase of interaction and initiatives being kicked off where people have got a bit more emotional and mental headspace for it.
For sure. I think I've noticed that at Ambulance Victoria, some people just welcome it really as a bit of a distraction from all the stress and the, you called it change fatigue. They kind of just looking to do something a bit more simple but pleasurable and rewarding and just uplifting, I guess, for a better world.
And I think they can all see the benefits to their patients, to the environment, to their work life. They feel like they're doing something very proactive and you know, they're always, I find that people are always wanting to bring their colleagues on board and educate and inform their colleagues as well. So, you know, again, you get that groundswell of action. You know, one of the points I wanted to raise when Emma-Leigh was talking was about what we need in our organisations is a cultural shift where sustainability isn't something that's tacked on and thought about afterwards. It's something that we consider up front in our decision making and everything that we do. And you know, that cultural shift is only going to come from that social movement from staff and getting people engaged, and they need to be the agitators upwards. Our executive are engaged in parts, but it's really important that our workforce and our staff are going to be the greatest champions that we've got, that they feel empowered to agitate and demand of their leaders that there's a change in the way we do things. So that cultural shift is something that I'm really passionate about, and making sure that the way we approach everything that we do has a sustainability lens taken to it.
Yeah, for sure. Sue, would you like to speak about some of the challenges that you've had and perhaps how you've overcome them?
Yeah, similar story. I think, you know, we've been really lucky to have a very strong board, CE and executive buy-in right from the start. And but our district gets hit with every extreme event, you know, except coastal inundation. So, you know, we've really had a couple of challenging years environmentally, and that's provided a lot of support for what we're doing. But COVID, obviously, that's been the cherry on top and has really been our biggest challenge because it's been so distracting to normal workflows and business as usual processes. Our sustainability plan was released late in 2019, and we had just had our first sustainability committee meeting in February of 2020. We were just getting the working group set up, and then COVID came along and it delayed a whole lot of that foundational work that we were doing at that time. So we've really started to reinvigorate the process and get traction again from the start of this year. You know, like Bridget was saying, people are really keen actually to get on with something other than COVID. So for us, it's been a case of persistence and patience, and to just work on what we could and to not worry about what we couldn't. So, for example, we had to let our waste working group, who have the most clinical members in all of the working groups, just deal with COVID and let them not be distracted by the waste working group activities too much. And we also had to be aware of that staff burnout and what we were asking of people. So, you know, we just did what we could in the background while some of us were working from home and not being able to do our normal roles. We just kept plodding away. And then now we're starting to get those clinical staff engaged and back on board again.
Yeah, great. We've got a couple of other inspiring comments from the chat as our medical students continue to be a source of inspiration. And there's the AMSA Code Green War on Waste National Hackathon coming up in September 17th. I think we should all be able to get on board there. There's a link, and conversations with patients too, who continue to be offer wider perspective on health, and their thoughts too are always a source of inspiration for us in healthcare. So we'll come back to you, Emma-Leigh, if that's okay. Among these challenges and with all the pressures on healthcare at the moment, how do you stay motivated and continue to do the work that you do?
I think a deep sense of commitment and purpose. So as I mentioned, it kind of comes back to understanding your why. So as a doctor, I first went to veterinary medicine, and I've come to medicine now with a deep sense of purpose to serve, I guess, and recognizing that we are part of a greater system. So within health, we have the privilege and responsibility of caring for people. And with that, recognizing that without caring for our community and without caring for our world, we can't actually do our job any justice. So I guess my purpose is to serve. I wanted to commit to that, act with honesty and integrity. And so that is what brings me back to doing the work that I do. It's what drives us all to be involved in healthcare. And I just see this as an extension of my job as a doctor. As Bridget knows, you could probably chain me underwater and I would still want to do this work. So I think that that's what keeps me coming back. And you know, I myself have had the physical and emotional fatigue of COVID over the last 2 years. It's been incredibly exhausting, horribly demanding, and we've all been flying by the seat of our pants, sometimes with staff furloughs and pressures on the ward, and just the overwhelming nature that it consumes the system. But being able to step back and realign with your purpose or realign with your why, and then also building strength and community around you. So I get enriched and my cup gets filled up when I speak to people who are equally as committed to this area. So find those people. They will be your strength. They will be your validation. They will listen to you and be able to hold space when you are consumed by grief. This work is a two-edged sword. It's incredibly rewarding, but there is a lot of harm and suffering. You know, climate change is the greatest health threat we face in the 21st century. We're seeing ecological crisis. There's a lot of eco-grief about the overwhelming nature of these problems and the injustice that occurs as a result of some of these things. And being able to hold space with people who feel that way and are able to help you through those emotions is also really important as well. So reach out, connect, build an army, a good army, but build an army. And just recognize that sometimes you need to step back to help yourself, and sometimes you're able to step forward and find that balance.
And thank you for staying passionate from all of us. Sue, I heard you mention your grandchildren in the introductory thing, but how do you keep motivated?
Yeah, look, for me, the motivation is actually the easy part. You know, as I said, I'm doing this for my grandkids, so I've got that really good reason or purpose, like Emma-Leigh was saying. You know, and I've now also got a growing number of people around me who are really getting engaged in this process, and we really stimulate and support each other. So again, same message, you know, get your army around you. I think for me, actually, it's more that feeling overwhelmed that I have to manage. You know, it's that waking up in the middle of the night, really worrying about what's happening to our planet and feeling really depressed about it. And I have to say, the more research you do, the more depressing it gets, because you really start to understand the challenges that we're facing. But that also gives you more motivation at the same time to do more. But how I manage the overwhelm, there's probably two things I think are key. Is one, that I just remind myself to focus on the small part that I can play, you know, to do what I can do. And if everyone does their bit, then we can create that change. And then I also take some mental time out. So again, repeating Emma-Leigh's message, you know, you've got to look after yourself. So I just go, I don't care anymore. It's not my responsibility. I'm going to go and play with my grandkids, you know, or I'm going to take a night off and watch rom-com, or just do something to bring myself back into that smaller reality and to take the weight of the world off my shoulders, because it's not my responsibility on my own. You know, or in the words of our famous story, just keep swimming, just keep swimming.
Yeah, I love it. Bridget, how do you stay motivated?
Like Sue, I have those moments in the middle of the night where I just think my job is so overwhelming that I don't even know where to start some days. And then I talk to people like Emma-Leigh or other people in our organisation that are doing great things, and that lifts me up. And these networks that we have here through GGHH and CAHA are so good. Everyone that you reach out to in this network is willing to share, support, listen. We're all in the same boat. We're all in different places in terms of and everyone's doing things quite differently as well. So I learn from the different people that are in the sustainability space, but their generosity around willingness to share materials, information, strategy, whatever it is. And I find that so motivating, and helps me feel that I'm not doing this alone, that I'm not just Nemo swimming, that that we're all trying to do the very best we can. It's just great that we have this opportunity to come together like this, because I think it's really important that we do that to continue our motivation, because it's really, really easy to be overwhelmed and have that environmental grief that, excuse me, Emma-Leigh spoke about. Sometimes you just got to put that to one side and think, okay, I can't take on too much more of that. What I need to do is take some action and find where I can feel like at least I'm making some sort of contribution. And so it's really that looking after self is important. But I find too, like, taking action and getting stuff done is also helps with that. You feel like you're actually making a difference where you can.
So true. Okay, we better leave some times for Q&A, but finally, what is your number one tip for anyone in the audience today who's wanting to become a sustainable healthcare champion? I guess mine would be the similar to all of you, is, start where you are with what you've got and do what you can, in your sphere of influence. So I'm not saying anything new, but we'll come back to you, Bridget. Is there one final tip that you can offer our audience today?
Just do it. Like, I think people overthink it. You might be overthinking that it's too big, it's beyond me, I can't. Just get started, start having conversations, start pointing out the issues, take it on as a project. Often working in your own patch, something that you see that's an issue, start with that. You don't have to change the whole world or the whole organisation on the first day. Start with what's within your sphere and what's within your sphere of influence, and work on that. That's the best place to start, is right where you are now. Lovely. Sue, would you have a final tip?
Yeah, same thing, just get started. You might be really surprised where it actually leads to. I know when I started this in 2018, I had no idea where I was going to end up now. Being seen as an expert in this space, really quite surprising to me. And also gather like-minded people around you. Don't try to win over the naysayers. That's just not worth the energy. They will eventually catch up on their own. There are a lot more people starting to have a greater awareness. So do what you can to bring them on board by talking about the issues and getting them to make small changes themselves. And if you don't feel confident talking about it, then CAHA and Climate Council both have some really great resources on how to communicate about climate change. So I suggest you have a look at those and do some other research just to make sure you really understand the issues and that you can talk about them confidently. And then you'll sound like an expert in no time. I mean, people think I'm an expert and I think I really don't know that much, but, I'm just out there talking about it.
Oh, yeah, wonderful advice. Emma-Leigh, what would be your final tip?
Yeah, very, very similar messaging. I guess understand your why and be able to articulate that, as Sue said. Just go out there and speak about it, and live that vision. So act with integrity and honesty. Start pointing things out. Change what you've got direct ability to change, but then recognise that this is not about the individual at all. This is about the system, and in order to shift the system, you need to find that network around you. So reaching out to organisations such as, if you're a nurse, reaching out to your nursing association. As a doctor, reach out to doctors, reach out to CAHA, reach out to people who have similar thoughts as you do. Build your army, but also, change what you can change and just stay true to yourself. At the end of the day, that's what will help you sleep at night as well. Yeah.
Oh, pearls of wisdom. Thank you so much. You guys have been great. We do have time for some Q&A now, though. So, and the audience are interested in more detail. Remy has asked Bridget, will SMHS measure whether the blueies have reduced with the July campaign? Are you measuring that project?
Yes, we are. So we know we're lucky we have data that shows usage by individual areas within our health service. So we've provided the areas with those numbers so they can see exactly how many they use on their ward or their area. And we asked them to pick a target that they felt that they could realistically reduce by, whether it's 10% or 20% or whatever it might be. And the plan is I've got a survey ready to go for 3 months, 6 months, and then potentially 12 months. And we will also be able to measure it through our business systems around our ordering system. So we'll know exactly, we'll have that data. Data is king in environmental sustainability, to be able to illustrate change, savings, so in that financial space, to be able to show that it has a financial benefit if it does. So yes, we are planning to measure it through a survey, but also we'll have the data around the numbers that are ordered as well.
Great. Yeah, there's so many of those ubiquitous items in healthcare. We found the same thing with the PVC recycling program, that 50 million irrigation flasks, and it might seem like one small object, the bluey, but it's actually a really powerful kind of message to start changing behaviours. I think that's really great. Okay, we've got another question to you, Bridget, from Hannah. What do your ambassadors do, and how do you collaborate with one another, please?
Our ambassadors really, their task is to take on projects within their own wards and areas. So our green ambassadors have been responsible for setting up green groups in ICU, cardiology, a whole range of places, state rehab where Emma-Leigh works. So it's an informal role, and we have had a few networking events. Obviously, COVID has impacted on what we've been able to achieve in terms of networking. But the idea is always we try and bring them together in an informal sense. So we set aside I think we called it our conversations with green ambassadors. So we didn't want it to be a formal place that people had to come to, like it was a meeting they had to turn up to. And we were having a case study from someone with the organisation that had done something, as well as something informative, someone to speak and to provide some information. The most recent one we did was to show the latest Damien Gameau movie to people. It's a little 17-minute documentary, and then spark a conversation around that. Unfortunately, with COVID and stuff, furloughs and everything, that kind of informal meeting and coming together is gone by the wayside a little bit, but it's something that we'll look to get going again. So what do? They do as much as they can in their own space, and come together and exchange ideas and create that network of that social movement in our organisation.
Wonderful. Okay, I'm not sure, I think any of you can have a go at this one, but Nayani has asked, have you analysed health system resilience strategies to overcome the problems following pandemic? Could you please share the sustainability framework? She also asked, would you be willing to share this sustainability framework? Sorry, would love to have a read and share with our executive team, etc. But I guess the core of that question is about health system resilience strategies. Would any of the panelists like to comment on that? I'll start off with you first, Sue, then Emma, then Bridget, if that's...
Yeah, definitely our HASFAC team and our disaster manager are looking at that space and how they can ensure that they're well prepared for it. I think they work quite closely with our disaster manager, and she's tried to have pandemic planning in that as part of that process since pre-pandemic days, and always found it a challenge to get people to take it seriously. I think that's, there now they understand that this could happen more and more frequently, I guess, with our, overpopulated planet. So they're really starting to develop those strategies and look more strongly into it. I have not across the detail myself to be more specific than that.
Lovely, thanks, Sue. Emma-Leigh.
Yeah, I guess if you look at Australia and all of the states more broadly, there's all sorts of adaptation work being done, so adaptation and resilience building. So it's now been recognised that nationally, looking at a national strategy for climate and health and adaptation work that includes, I guess, pandemic type recoveries or for extreme climate disaster recoveries. That's something that's happening nationally, and it's great to see some movement on that finally. And all of the states have similar processes going on. So we know that Queensland now has a state climate adaptation plan. Victoria's got one. Western Australia is in the process of looking at that as well. So I think that will really help in guiding health services and hospitals and health organisations in building their own resilience plans. But it's also recognising, I guess, that resilience is about minimising vulnerability, and that comes back to communities. So looking at the people that we serve and how do we actually make resilient, just, empowered communities that have autonomy and are able to make their own decisions, and that will really help as well. So as a clinician, what can I do in that space? How can I help to ensure that the people that I serve and the things that I do more broadly are helping to ensure that there's health equity and justice for all? And then within my health organisation, I guess just elevating the issue. But all of the organisations now are recognising that these things are going to become more frequent. So how do I ensure that the infrastructure and the services that I have are going to be able to face the increasing health demand? So there's lots of stuff happening.
Yeah, I could probably comment on that too. From Ambulance Victoria, we've done a climate and health adaptation action plan. That's a 4-year plan, happy to share. And it's kind of talks about buildings and infrastructure and assets and all those kind of things. But as Emma-Leigh suggests, it's about vulnerable communities and people highly impacted by climate change. They're identified in the literature, and we need to kind of think specifically about them, and they're the communities that are already impacted. They're the CALD, the culturally and linguistic communities. They're the people who are already impoverished, the low socioeconomic, poor housing. They're very recognised and underprivileged groups anyway. So program design is a big thing, and I think reaching across the healthcare system. So Ambulance Victoria are pre-hospital services, and these guys are more kind of acute hospital services, but there's a lot between those services, primary, secondary and tertiary healthcare, and there's a lot of gaps in between. So I think we can join hands across, climate risk and really tighten up the gaps of the things where people fall through. And I think it's a really interesting body of work, and it's a really interesting, I really love it as a topic. I'm really enjoying kind of getting our teeth into that space as an organisation, and so are the clinicians and paramedics and who are feeling it every day on the road. And
just to
really,
just to steal a moment on that, in that I think the other way to look at these population and these communities is actually they are incredibly resilient. So they have gone through a lot of adversity, and the lived experience they have is knowledge in its own right. So I think part of what we actually need to do is make space for their voices, and they need to tell us and teach us what they need, and they can teach us a lot about resilience and strength. So I think the real beauty in recognising those groups that are strong through vulnerability is understanding how we can do better to listen and better serve those people. So I think it's that two-way relationship, and we really need to step back and say, hey, look, people with disability, or those who have lived through poverty, or those who have lived experience of climate, on our First Nations folk especially. So what do we need to learn? How can we listen, and how can we do better? What do you need us to do? So making room for those voices will build resilience for everyone.
Absolutely. Fabulous. Well, on that note, we've got a couple of minutes to go, so I better hand back to Steph. But thank you, everyone. And over to you, Steph.
Thanks, Kath. I'd like to say a huge thank you to you, Kath, Sue, Bridget and Emma-Leigh for being here today and for sharing your extremely valuable insights and expertise on how to become a sustainable healthcare champion. I'd also like to thank everyone in the audience for your participation and engagement in this discussion. We will be sending around a follow-up email with the recording from today and links to all of the resources discussed during the session. If you enjoyed today's event and you're interested in learning more about sustainable healthcare, we invite you to join us on Friday, the 7th of October, online and in person in Newcastle for the annual 11th Greening the Healthcare Sector Forum. Our theme is driving systems change for sustainable healthcare and will feature a wonderful range of expert speakers. Tickets are available for purchase through the CAHA website now. So for our next healthy conversation in September, CAHA is partnering with the Lowitja Institute to host a very exciting discussion on always caring for country. You'll receive a link to RSVP in the follow-up email after this. Finally, if you've enjoyed the event today and would like to support us to continue this work, join us as a member or make a donation today. Thanks again for joining us and enjoy the rest of your day.
Lovely. Thanks, Steph, and thanks, everyone.
Thank you.
Thank you.
Bye.